Hi everybody. Thank you for joining our town hall today to learn more about the Bargas Wellness membership programs. I thought I would start this out by telling you a little bit about myself and where I've been and what got me here and why we have the membership programs to begin with. So I went into a conventional cardiology and electrophysiology practice here in Oklahoma 10 years ago, actually, next month, I think. And I was an employed electrophysiologist at a health system in town for about 6 years. And during that time, I treated a lot of patients with coronary disease, high cholesterol, hypertension, cardiac rhythm disorders. I did countless procedures on people, putting in pacemakers and defibrillators and ablating abnormal heart rhythms. And I loved all that work, but an overwhelming theme was that all of that, with rare exception, doesn't actually cure the patient or make them well. And my passion has always been to get people better and to help them live their healthiest lives. I found that in that model, we're not incentivized to actually help people and get them better. In an insurance-based model, we are actually compensated based on how much we do for the patient. A lot of people don't know this, but the level of billing is dependent upon how many labs I order and how many prescriptions I write and how many procedures I recommend. And the more I do, the higher my billing and the more I get paid. I'm not compensated to spend an hour with a patient teaching them how to eat better and what exercises they can do to help get themselves off blood pressure medicines. I even found with this one particular condition that I treated that was one of the reasons why I fell in love with electrophysiology. It was one of the rare exceptions in conventional medicine where we can actually cure somebody of a condition and they never ever have to come back and see you for that condition. And I found that referring providers wouldn't even send these patients for this procedure, which is simple and curative, because it meant the patient would never have to come back and there would not be a source of revenue anymore going into the future. And I found this very disheartening and disappointing, and that was not what I want for me and my patients. I want to develop a relationship with my patients. I want them to be committed to their health and their wellness and getting better. And again, my favorite thing is to stop medications, not start them. But there's not room for that in the conventional insurance-based model. So about 2 years ago, I started my wellness program and my wellness practice, and I've been developing it since that time. And I've developed my functional medicine practice as well. And any of you who have been to see me in my integrative cardiology or functional medicine practice can attest to the fact that it takes a lot longer than standard of care. And it's a much deeper dive into the, cracks and crevices of your health to cure things and to improve things long term and to prevent the need for pharmaceuticals. And the reality is that conventional medicine, health insurance and the insurance-based model does not pay for that. It can't pay for that. It takes too long. We might think that it should pay for that, but the reality is that it doesn't. So if I'm going to continue to provide this care that I'm passionate about and that I truly believe helps people's health and wellness, then there has to be a membership plan for that so that we can be compensated. That's why we have developed the membership program, and this is an excellent opportunity for people to have access to this higher level of care that is just different than what you'll get in the conventional world. It's very exciting, and a lot of people are going to benefit from it, and all of us here at Bargas Wellness are excited to get people involved in this program where they can truly get well. I wanted to also just offer an example for those of you who are still kind of confused. Well, how is the care different? I will say that you'll always get standard of care at Bargas Wellness. It's not like you come here and I won't give you a medication that you need because, I would rather you change your lifestyle. I would rather you change your lifestyle, but if you need a medication, then I want you to have that medication. You'll always get standard of care no matter what program you're in here. An example of a difference is a patient that I have who has high cholesterol, and he has a strong family history of coronary disease and heart attacks. His father had his first heart attack at a relatively young age in his late 40s. And this gentleman doesn't want to follow in his father's footsteps. So he is being proactive and he wants to get a handle on his cholesterol and other risk factors. Well, he was seeing a conventional cardiologist in town who tried him on multiple different cholesterol-lowering medications, the class of medicines called a statin that many of you are probably familiar with. And he couldn't tolerate the statins. They caused horrible side effects, everyone that he was on. In functional medicine, we say there's no such thing as a side effects. There are effects. There's favorable effects and unfavorable effects. And he couldn't tolerate the unfavorable effects. And when he finally was like, I'm not taking this class of medications, the doctor told him there was nothing more to offer because statins are the way to lower your LDL, and if we can't lower your LDL, you're going to have a heart attack like your dad. Well, he sought me out, and through advanced testing of digging deeper into his cholesterol and his fatty acid profile and his inflammatory markers, I found many areas of opportunity to treat him and help him. We know now that your bad cholesterol is not the only thing that increases your risk of heart attack. People have heart attacks every day that have normal bad cholesterol. We know it's a combination of insulin insensitivity and high glucose and inflammation. And so through advanced testing, I can look at all of these things. And by modifying this gentleman's diet and putting him on a couple nutraceuticals to optimize his fatty acid profile and improve his good cholesterol, he now actually has a completely normal lipid profile. He has normal blood sugar. He's not insensitive to his insulin, and he has no inflammation. He is at exceedingly low risk of ever having a heart attack as long as his markers stay the way they are, and he is not on statin therapy. So that's the difference between conventional and integrative cardiology and functional medicine. I hope that helps clear up some questions that you all may have, and I would love to see you in the Bargas Wellness Integrative Cardiology and Functional Medicine program. Be well.